Hi friends, I am Dr. Pratap Singh Rathore. I have done the MD in Voice Medicine, and today we'll discuss about explosion injuries. In this, we'll discuss about first of all about explosives, injuries caused by explosives, and lastly about molecular aspects of explosives. Coming to explosives, explosives are mainly is a container filled with an explosive mixture and missiles. Missiles may I think contain make like contain pellets or any metallic substance may be contained which is fired by a detonator or by a fuse. There may be different types like incidental explosives, mainly like napalms, which causes burns, usually consist of phosphorus and magnesium, and temperature may reach up to 1000 degrees, or like Molotov cocktails, which are like incidental explosives, which is thrown by hand. It is a crude form of explosion in which bottle is filled with gasoline and rag is inserted into the bottle and it is lit and thrown on the target for create explosion. Based on materials used, the explosives are divided into high order explosives, HEs, or low order explosives. High order explosives undergoes detonation, producing an instantaneous blast wave under extremely high pressure, causing severe blast injuries. So these are mainly produces instantaneous blast wave. Like example like TNT, dynamite, ammonium citrate, C4 plastic explosives all comes under high order explosives. Low order explosives they undergo deflagration rather than detonation and thus lacks in blast waves. They lack just explode and burn. They do not they do not have detonation like fireworks or like Molotov cocktails. Now coming to mechanism of explosive injuries, blast injuries caused by exposure is a complex type of physical trauma resulting from direct or indirect exposure to an explosion. So exposure is nothing is not a single event. So there is when the explosion occurs, there is a blast wave, then there is a movement of air, then also there is flying missiles. Flying missiles may include the content of explosion, explosives, or anything surrounding the area of the explosion may also serve as a flying missiles, which may also cause injuries. So explosive pressure that accompanies the bursting of explosives or shells rupture the casing and imparts high velocity to the resulting fragments. So these fragments have a potential to cause more devastating injury to tissues than bullets because they do not have a specific shape and size. They may cause devastating injuries. Explosives are all accompanied by a complex waves. So there are two main components of this wave. One is the blast wave known as dynamic overpressure with a positive and negative phase and a blast wind which is a movement of air. Injuries are mainly due to the initial shock wave but are aggravated by subatmospheric phase. Blast pressure wave flow around an obstruction and may affect anyone sheltering behind the wall or trench also. So blast wave doesn't hindered by obstruction, they may injure even when the person is near a wall or behind a wall or trench. The mass movement of air, that is blast wind, disrupts the environment, throwing debris and people. So blast wave is a movement of air which may throw debris as well as any person who is in the near the vicinity. When the body is impacted by a blast pressure wave, it couples into the body and sets up a series of stress waves which are capable of injury, particularly at air-field interfaces. Mainly like cavities like peritoneum, it may cause severe injuries. Explosion injuries may cause different effects on the body. There are different types of injuries like disruptive effects where it may rupture the body parts. It may cause burns because of severe increase in temperature, air blast because of hot air as well as air pressure, flying missiles which may because of exposure as well as explosive materials, falling machinery that is because of explosion. Any building or any vicinity compounds may fall off on the person who is standing nearby or by fumes that is toxic fumes may also released from the explosion that may also damage the injuries that may also damage the person who is exposed to explosion. So mainly the blast injuries are divided into four categories of injuries. One is primary, secondary, tertiary and quaternary. So primary injuries are caused by blast waves. So when the explosion occurs, it releases waves of sound as well as blast waves, which causes injuries, which are characterized by absence of external injuries. So because this is waves is just a movement in the air, sound as well as air pressure. They do not cause external injury, but they only have internal injuries. They usually have internal injuries which are often unrecognized and their severity is underestimated. The ear are the most common affected by the overpressure, followed by lungs and other organs of gastrointestinal tract. So most common injuries are seen near the ears, then later on in the other organs like gastrointestinal tract. GIT injuries may present after a delay of hours or even days. Primary blast injuries are like acoustic biotrauma in the ears, blast lung in the lungs where the lungs may get ruptured, gut injuries that is in the GIT, in the stomach or intestines, as well as brain damage may also occur because of blast wave. Secondary explosion injuries. Secondary injuries are due to people being injured by sharp nails or other objects propelled by the explosion. So, because of explosion, sometimes which are vicinity, the explosive materials as well as anything which is present near the air, near the explosion like stone, gravel, anything may be propelled and that propelled materials may hit the person standing nearby. These injuries may affect any part of the body and sometimes result in penetrating trauma. So these are flying missiles with these are flying missiles which are traveling at a very high velocity like bullets and may penetrate the body, creating any type of injury. Most casualties are caused because of secondary injuries. Some explosives, such as nail explosives, are purposely designed to increase the likelihood of secondary injuries. So, this type of nails, sometimes explosives may contain nails to increase these type of injuries. Penetrating thoracic trauma, including lacerations of heart and great vessels, is the common cause of death in case of in these secondary injuries. So this is the image depicting the type of injury. Primary injuries are caused by blast waves. Secondary injuries are caused by projectiles which hit the person. Tertiary injuries are because the person itself, the person who is standing near the explosion, are thrown outside and that person may hit other object leading to tertiary injuries. So tertiary injuries are injuries deriving from the blast wind that can throw the victims against any solid objects. Tertiary injuries may present as some combination of blunt and penetrating trauma. So blunt trauma may be because of the person hitting on a stone. Penetrating trauma may cause of any sharp nails may penetrate him, including bone fractures, coup injuries and corticope injuries in the brain. Coup and corticope injuries are mainly seen in the brain where the brain which move inside the CSF may hit one side. So coup injuries are where primary injuries occurs. Corticope is where the brain while moving while stationary, sudden stoppage of the head may cause the brain to move backside, leading to corticope which is in near the backside. So front injury may lead to uh, cope injury, then corticope injuries may also occur. Children are very particularly at risk because of their low weight. They may are easily thrown outside and leading to injuries that are tertiary injuries. So these are images depicting the exposure injuries. So this is a rupture of the abdomen because of explosions. This is a deformed face because of secondary injuries. Then quaternary injuries. These are miscellaneous injuries where injuries doesn't. These are the injuries which do not come under first, primary, secondary, or tertiary injuries. So any injury which doesn't included in the first three all comes under quaternary injuries. This includes like flash burns because of heat. There may be flash burns, crush injuries, falling resulting from explosion. Because of explosion, the person may fall. Respiratory injuries caused by toxic dust, gas, or radiation exposure. So any type of injury may comes under all these type of injuries comes under quaternary injuries. Some type of psychiatric injury also are included in quaternary injuries because psychiatric injuries like neurological damage sustained during the blast is most common. Then there is post-traumatic stress disorder may also affect people who are otherwise completely uninjured. So person may experience PTSD even though the person may not be have the any external injuries. Most common urgent clinical problem in survivors usually include the penetrating injuries caused by the blast energizing debris and fragments from casing of the exploded devices. So serious problems occurs only in case of penetrating injuries which has to be addressed first. Many of those exposed will have blunt, blast and thermal injuries in addition to more obvious penetrating wounds. The soft tissue wounds are heavily contaminated with dirt, clothing, as well as secondary missiles such as wood, masonry, and other materials from the environment of filing. flying missiles. Now, medical aspects of explosive injuries. First, we have to decide what type of explosion was there. So, explosion may be different types, may be artificially made by the humans, or it may be of accidental, like gas cylinder burst also. So, first we have to decide which type of explosion was there. So, based on that, the injury will differ. Then, any case of number of dead persons, then we have to identify the dead persons. Identification of dead body may be done many ways. If face is not recognized, it can be done by bones or dental records. Then in a living person, we have to enlist the injuries to cross-reference to type of explosion. Then cause of death has to be determined. It may cause of death may be differ, whether it may be because of explosion or because of sometimes the person may have been killed and it may be fabricated as explosion also. So circumstances of death has to be clearly noted whether the death was because of explosion or because of any homicidal or suicidal. It may also be there. So circumstances of death has to be clearly known after doing postmortem examination. These are my references. Thank you.